Gastroenteritis, often called a stomach infection or stomach flu, is one of the most uncomfortable and draining conditions you can experience. It comes suddenly and can knock you off your feet with symptoms like vomiting, diarrhea, stomach cramps, nausea, and fever. It's caused by an inflammation of the stomach and intestines, and although it's usually short-lived, it can be extremely unpleasant. The most common causes of gastroenteritis are viruses, bacteria, or parasites. Among viruses, norovirus and rotavirus are major culprits. Bacterial causes include E. coli, Salmonella, and Campylobacter, which are often contracted through contaminated food or water. Sometimes, it can also result from poor hygiene practices, like not washing hands properly after using the toilet or before handling food. Children, the elderly, and people with weak immune systems are more vulnerable to stomach infections. Once infected, symptoms usually appear within a day or two and can last from a couple of days up to a week. The illness starts with mild discomfort, maybe just a loss of appetite or a feeling of unease in the stomach. But soon, it can escalate to frequent loose motions, nausea, and vomiting. Some people may also experience headaches, muscle aches, low-grade fever, or chills. The body loses a lot of fluids and essential electrolytes, which can lead to dehydration. Dehydration is especially dangerous for infants and older adults, so it's important to keep an eye out for signs like dry mouth, little or no urination, dizziness, or fatigue. During an active infection, it's vital to rest and focus on staying hydrated. Drinking oral rehydration solutions, clear broths, or electrolyte-rich fluids can help your body recover. Avoid caffeine, alcohol, and sugary drinks, as they can make symptoms worse. Food should be light and easy to digest. Think of boiled rice, toast, bananas, or applesauce. Spicy or greasy foods should be avoided until the stomach settles down. Some people may take anti-nausea or anti-diarrheal medications, but it's best to use them under a doctor's guidance, especially in children. Prevention is always better than cure. Proper handwashing with soap and water, especially before eating or preparing food and after using the restroom, can reduce your risk dramatically. If you're traveling or in an area with poor sanitation, it's best to drink bottled or properly filtered water. Washing fruits and vegetables thoroughly, cooking meat completely, and avoiding raw or undercooked foods can also help prevent bacterial infections. In most cases, stomach infections resolve on their own with home care. However, if the symptoms persist beyond a few days, or if there's high fever, blood in stool, severe dehydration, or uncontrollable vomiting, you should seek medical attention immediately. In some bacterial cases, antibiotics may be required, and in cases caused by parasites, specific antiparasitic medicines are given. For babies and young children, keeping them hydrated is the top priority. Pediatric electrolyte solutions are often recommended. Breastfeeding should be continued, and small, frequent meals can help them recover more comfortably. Parents should monitor for any signs of worsening, such as lethargy or sunken eyes, which may indicate serious dehydration. Even though it feels horrible when you're in the middle of a stomach infection, the good news is that most people recover fully within a few days. With proper care, hydration, and rest, your body will bounce back stronger. It's also a good time to reflect on your hygiene habits and make improvements that can prevent future infections. So, next time you feel a strange rumbling in your stomach or notice symptoms like diarrhea or nausea, don't ignore them. Act early, rest well, stay hydrated, and avoid spreading the infection to others by maintaining cleanliness. Your stomach is your second brain, and keeping it healthy is key to your overall well-being. Take care of it, and it will take care of you.